Today's health headlines. Today is World Hepatitis Day. What to know about hepatitis prevention and treatment? Joining us this morning is Dr. Joseph Lim, Yale Medicine gastroenterologist, who specializes in liver diseases. And he is also a professor and vice chief of digestive diseases at Yale School of Medicine. Thank you for your time.
Yeah, thank you for having me.
Of course. So let's start with this today, World Hepatitis Day, as mentioned. Tell us more about hepatitis. What should we know?
Absolutely. So today, July 28th, is World Hepatitis Day. It's a day that's set aside when medical, public health, and patient advocate communities join together to raise awareness about viral hepatitis. For those of you who are not familiar, hepatitis refers to five very common viral infections that affect the liver. These include hepatitis A, B, C, D, and E. This can be very confusing, but there are differences between these viruses. Two of them, hepatitis A and E, are typically transmitted by contaminated food and water, such as when traveling to endemic countries overseas. And these typically are temporary infections when we can become very sick, but then recover fully. In contrast, hepatitis B, C, and D are chronic infections, and these are truly transmitted by blood or other body fluids. These include things such as tattoos, body piercings, injection drug use or intranasal drug use, or intimate contact with infected persons. Now, this is very serious because when left untreated, this can ultimately lead to major complications such as liver cirrhosis, liver failure, and liver cancer. And that's why World Hepatitis Day aims to educate the public to test, treat, and eliminate hepatitis.
I feel like we just learned a lot just from this little bit that we've been talking so far this morning. So that is very important and good to know. But let's talk more about the treatment plans. Obviously, you mentioned there are different forms of hepatitis, different types. But why is it so important, regardless of which you have, to treat right away?
Very important question. Step one is to test and treat. Hepatitis, fortunately, can be screened with very simple blood tests. In fact, the CDC recommends that every American adult aged 18 or older should be tested for hepatitis B and C. And if it's positive, we're very fortunate there are very effective therapies that can either control the infection or to cure it completely. In the case of hepatitis C, you can actually achieve permanent cure in 95% of patients when treated with pills called direct acting antivirals for just 2 or 3 months. So if you are tested and are positive, you have great treatment. And if you're not positive, great news. But you can go ahead and get vaccinated to prevent infection in the future. I like to emphasize that hepatitis B vaccination is actually recommended for every infant, child, and adult up to age 59. And so I encourage those of you to go ahead and get tested and treated if positive, and to get vaccinated if not already immune.
Good to know. And lastly here, doctor, what is your message to viewers about this disease?
I think many are not aware that viral hepatitis is far more common than we realize. Globally, we're talking about 250 million persons with hepatitis B, 50 million with hepatitis C. And most of those who are infected don't know it yet because they often don't have symptoms until they have advanced liver disease with liver failure or liver cancer. So don't wait. Talk to your doctor today about getting tested. And if you're negative, consider getting vaccinated. Protect you and your family from future infection. And if you'd like more information, I encourage you to go to liverfoundation.org or cdc.gov/hepatitis.
Very well said. An important message for sure. Thank you so much for the work that you do, and thank you for your time this morning.